Hello everyone, I'm Dr. Vivek Venkatramani, consultant uro-oncologist in Mumbai. Today I'll be talking to you a bit about a prostate biopsy. A prostate biopsy is basically the confirmatory test that we use to diagnose prostate cancer. It involves collecting a few samples, usually by ultrasound guidance from the prostate, and then submitting them for microscopic examination. This will tell us regarding the presence of cancer or whether there is infection or benign enlargement of the prostate. This is the final confirmatory test for any prostate cancer, and based on the biopsy report, your doctor will prescribe what would be the next steps. So when is a prostate biopsy needed? A prostate biopsy may be needed if your PSA is high, above the normal range for your age, and if there is any specific lesion that is seen on the MRI which supports a suspicious area in the prostate which should be biopsied. Sometimes, if there is an abnormality on the rectal examination, which is when the doctor examines your prostate, he may also recommend a prostate biopsy even if the PSA is normal, because that may itself be a suspicious nodule. Finally, sometimes we do prostate biopsies if the PSA goes on rising and the previous biopsy was negative, in order to be more precise and more sure that there really is no cancer and we don't know what the other cause of the rise of PSA is. In preparation for your prostate biopsy, your doctor may prescribe a few blood tests, especially to detect if there are any bleeding or clotting problems. A urine culture may be needed if there is any suspicion of infection, because that should ideally be treated prior to the biopsy. If you are taking any blood thinners, those should be stopped at least 5 to 7 days before the prostate biopsy after consultation with the cardiologist. Otherwise, generally the preparation is pretty simple. You may be started on antibiotics a couple of days before the procedure. There is no fasting involved. It's generally an outpatient procedure under local anesthesia, and you would be ready to go home the same day. So how is the prostate biopsy performed? It is done under local anesthesia, like I told you. The prostate is numbed with an injection or some jelly around the prostate in order for you not to feel any pain. The procedure is done by ultrasound guidance, and small probe of the ultrasound machine is passed through the rectum, and that allows us to visualize the entire prostate. Through that, a needle is passed and 6 to 8 samples are taken from each side of the prostate and submitted for examination. If there was any suspicious lesion on the MRI, we may target that separately with another 2 or 3 samples. The whole process takes mostly about 30 minutes, and then we would observe you there in the clinic or in the ultrasound department for a couple of hours and make sure you've passed urine before you can go home. In rare cases, if a patient is very anxious or very worried about the pain, we may do this under anesthesia in the operation theatre, but more than 99% are done on an outpatient basis in local anesthesia. After the biopsy, you would be home in about 2 or 3 hours, and generally the recovery is pretty quick. There may be some soreness in the rectum area through which the biopsy was taken for a couple of days. There may be some bleeding when you pass motion or when you pass urine for 2 to 3 days, sometimes up to a week, but that generally clears spontaneously and no further treatment is required. Blood may be noticed in the semen for up to 6 to 8 weeks after a biopsy, and that is pretty much normal. It doesn't affect the erection or ejaculation in any way. As per normal activities, you should be good to go in about 3 to 4 days after the prostate biopsy. There are some risks or complications of a prostate biopsy, the most important of which is infection, which is why we generally do the urine culture, rule out any pre-existing infection, and cover you with antibiotics through the procedure. The risk of urine infection is about 4 to 5%, and a severe infection requiring hospitalization and injectable antibiotics may be seen in about 1 to 2% of cases after a prostate biopsy. Today, newer techniques like a transperineal biopsy are being discovered and being fine-tuned which allows us to almost reduce the incidence of infection to zero. Other complications include, like we discussed, some bleeding from the urine or the rectum during motion and urination. And rarely, some men who already have difficulty passing urine, the urine may stop after the prostate biopsy because of the swelling of the prostate gland, and that may need a temporary catheter for a few days. So these are generally the side effects that can be seen or the risks of a prostate biopsy. 99% it goes very smoothly and there is no trouble at all. After the prostate biopsy, it usually takes about a week to get the results back. 15 to 25% of prostate biopsies actually turn out to be positive for cancer. This depends on the PSA level that you had before and also the MRI findings. So based on that, we can give you a more precise estimate. And depending on what the biopsy results are, then we decide what would be the next step. If it's benign, it generally involves just continuing the medical management and watching the PSA carefully. And if it turns out to be malignant, then we probably would do your PET scan, a PSMA PET scan to stage the disease and then decide on the appropriate course of action. Patients often ask me how painful the biopsy is. Generally, it's not a very painful procedure. The local anesthesia works really well and most patients tolerate it without any issues, and they are walking immediately after the procedure and back to their normal activities in a couple of days. If they are, like we discussed, very anxious patients, sometimes we may do it with a full anesthesia. So just to conclude, a prostate biopsy may be recommended by a uro-oncologist in case of an elevated PSA, an abnormal examination or MRI findings, and to determine whether you actually have prostate cancer or not. It's generally an outpatient, safe and very small procedure, and you will be back to your routine activities pretty quickly after that. If you found this video beneficial, please like and share it and subscribe to my channel. Thank you.